Hello, everyone, and welcome to Fearlessly Authentic. I'm your host, Jody Harrison Bauer, and I am so happy to have you here with us today. If you are new to the show, this is the place where we educate you, empower you with that education, and inspire you to live your most fearlessly authentic life. Because in my opinion, at the ripe old age of 63, if we are not trying to live our most fearlessly authentic life, what the heck are we doing here? And today's guest is going to help us do this. I can't wait to share him with you. But before we get started, I want to remind you to rate, review, and subscribe. This is how we reach more people. Remember to press that subscribe button, and you can follow me at Jody Harrison Bauer on all social media platforms. And you can find this show on all streaming podcast platforms, including YouTube. But don't watch YouTube while you're driving. So welcome to the show. And I am here today with Dr. Jason Champagne. Thank you so much for joining me today.
Absolutely. It's my pleasure. I can't wait to get started.
Me too. We have so much to talk about. This is one of my favorite subjects. But before we get started, I want to introduce you to our listeners. Dr. Jason Champagne is renowned as one of Hollywood's foremost facial plastic surgeons, known for his artful touch and customized approach to procedures. Favored by A-list celebrities, he has garnered attention for his signature champagne brows, sported by stars like Chrissy Teigen and Meagan Good. Beyond eyebrows, Dr. Champagne specializes in jaw surgery, chin implants, forehead reduction, and rhinoplasty, offering personalized transformations that deliver natural-looking results. Setting himself apart, Dr. Champagne employs 3D CAT scans to craft custom jaw and chin implants, ensuring flawless outcomes tailored to each patient. His expertise extends to the innovative Champagne Hairline Refine, a precise procedure for hairline modification, advancing the forefront of aesthetic facial surgery. With a wealth of experience and expertise, Dr. Champagne is also a published author, sharing his techniques in facial aesthetic surgery, hairline lowering, and hair restoration with colleagues worldwide. Based in Beverly Hills, his practice epitomizes excellence in cosmetic facial procedures, drawing clients seeking refined, elegant transformations. Welcome again. That's a lot. You
Wow,
do a lot to help. What does that sound like to hear all that, right?
it's great. Honestly, I mean, coming from a small town and no one in medical in my family, no doctors, nothing. Being where I am and having achieved these things, it's crazy, but I love what I do, and
Yeah,
exciting for me to help patients achieve their goals every day. So here we are.
right. Yeah, here we are. So can you tell us um, how you began this journey as becoming Hollywood's foremost facial plastic surgeon?
Well, I mean, I can say that it started a long time ago where I wanted to pursue medicine and I knew I wanted to be a physician. Becoming a surgeon started somewhere in the high school years where I
Mm,
realized that I was really good with my hands, and I had a lot of things that led me to that point. But into medical school and residency, facial plastic surgery really became the goal for me, because I realized I can use my ability of artistry and knowledge of science to kind of combine into one goal and help patients achieve their goals through that. And so that's where we are today.
And it really takes an eye. I won't say specific, but it takes an eye, whatever that eye is for that patient, whoever chooses to hire you to do their plastic surgery. Um, it takes that eye that you want. And for so many years, everybody looked plastic. And I'm seeing that it's definitely moved in the last 5 years, even 5, 6 years, to everybody wants to look more natural. They're going away from the big lips. They're going away from, I'm sure you read all about Lisa Rinna and the lip filler or the lip implants, whatever it is that she has, but it looked like she had a lot of filler. And I look back at pictures of me in my mid 50s, and I see that I was getting overdone filler, right? So now we're in an area where surgeons like yourself, I see, are focused more on facial. Like it used to be that you went to a plastic surgeon who could do your boobs, who could do lipo, who can do your facelift. But now there are specific doctors. Everybody's gotten very nichey. So do you understand why how that all happened? And do you feel like all the doctors are becoming much more nichey?
I do, and I think it's definitely for the better.
I think so too.
Facial plastic surgeon like myself, I only specialize and operate from the neck up.
I love that.
I've never trained or would ever consider operating on anything below the neck. It's sort of out of my territory, and that
Mhm.
allows me to stay focused. And every day I'm in practice, operating or seeing patients in the office, it's specifically focused on this area. I understand the anatomy so much better than someone else who might do body work, because they're not trained specifically on the face. And that's okay. I think we all need to be specialized to be able to give our best to our patients and give them what they really deserve. So as a facial plastic surgeon, I'm only focusing on that. I'm looking at your facial balance. I'm judging your anatomy specifically and recommending treatments that are just for you, because not
Mhm.
everyone's the same. Not everyone's going to benefit from the same exact procedures.
Not one size fits all.
It's not, and so
No.
we've learned that over the years, and thankfully I'm at a point in my career where I've come out beyond all of the initial stages of plastic surgery, like in the 70s and 80s and even 90s, to where we've had a lot of time to learn what works, what doesn't work. It's not one size fits all. Not everybody gets the same kind of nose and all of those things. And to your point with filler, even, it was a little bit of a learning curve, right? So initially, when filler first came available, everybody was like, oh, this is going to be great. It's going to change the game. We can just fill instead of doing surgery. Well, what we realized over time is that a lot of filler is not good for you. It stretches skin as we age. If you're trying to keep the skin tighter and lifted with filler, you're just going to end up filling a balloon, basically, and you just start looking puffy.
Yeah.
Because that skin still is loose, but you're just trying to tighten it with filler, or you're trying to lift it with filler. And so people start looking strange and different, and it doesn't look like you anymore. And so we definitely, especially in my practice, I really focus on staying very conservative and doing things that will help you to maintain your natural look, but enhance it, or, just rejuvenate you so you still look like yourself, just a more youthful version of yourself.
I love that approach. And going back to what you were saying about filler, and I don't want to spend that much time on filler, but when I see people younger than me filling up their face when they really should be getting a facelift or a mini facelift, I tell them that, like, stop with the filler. And women want to know that somebody's not going to sell them, right?
Right. I'm not in the business of selling you on anything. I will turn more patients away than I
Right.
will say you're a good candidate for, just because nowadays social media has made it
Right.
so readily available for people to see all of these possible procedures that they can have. And I've seen some really horrible outcomes.
Mm.
Filler thing is way too much in a lot of patients. And I would say a good thing that I'm starting to see, I'm starting to see a trend towards is younger patients wanting to get involved earlier in their life, right? Get earlier treat
Doing what?
doing preventative things in
Like
general.
Botox? Like Botox?
Botox, maybe a little bit of filler if it's necessary. And we'll get back. I want to get back to that because you said, at postmenopausal, it all sort of makes sense. And I'll get back to that. But more in the sense of skincare.
Mm,
Take care of my skin now because I realize that if I don't, I'm going to regret it later. And so
absolutely.
that to me is a breath of fresh air that I'm
Mhm.
seeing that, because
Yeah.
it's much harder to turn back time than it is to go forward doing preventative things that help you to maintain your skin and the health of your skin and the appearance of your skin over time. And so,
Believe me, I know. That's what I'm trying to do right now. Please, everybody listen to Dr. Champagne.
yeah,
Take care of your skin now.
right. And we can get into that if we have the time for it, because it's things like avoiding the sun. The sun is one of the most powerful things that we can avoid. And using sunscreen, I'm not saying stay indoors your entire life, but
Right.
using the right kind of medical grade sunscreen and appropriate skincare regimen to keep your skin healthy will help you age gracefully over time. So you're not having to do all these aggressive procedures at a younger stage. At some point you may, but some point you may not. And I'm okay with that. I'm not trying to have everyone come in my office for a facelift, but it's more about, and look, we're all learning so many things about longevity, and we
Mm,
feel so much younger than we look nowadays.
right.
A lot of us, that if I can help patients to look the way they feel and just
Mhm.
continue to live their happy lives, I'm here for all of that, you know?
Right.
So I think that's where I stand for sure in my practice. It's more about a conservative rejuvenation, keep you looking like yourself over time.
How does it depend on the person with how young would somebody be to do a facelift on? And I know you talk about the different facelifts. There's the mini, there is the upper cheek, middle,
Well, there's the mid face, which is
mid face.
totally different than a facelift itself.
Right, right. So let's talk
There,
about the facelifts.
there's a deep plane facelift.
Right,
There's all sorts of lifts, and they can come by different names. Some surgeons are calling the same kind of lift by a different name just to make it
right,
different or unique. But there are some basic facelift techniques that we use to rejuvenate the face. Um, Everyone is different. Genetically, some people start to age sooner,
right,
regardless of how well they take care of their skin. And it has to do with their skin quality,
right,
thin skin versus thick skin. There are certain ethnicities age better, as we all know, than
right.
other ethnicities. We know that. And so I would also say everyone's unique, right? We know
Mhm.
that. Everyone is an individual. I treat everyone as an individual. So when you come into my office, I'm looking at you. I'm using my experience with from the past, but I'm looking at your face. I'm feeling how thin your skin is. I'm lifting. I'm feeling how easily mobile the tissue is going to be, because that will give me an idea of how good or not so great of a result you might achieve. Because not every patient is a great candidate for a facelift, for example. You know, if they have
Right.
certain tissues that I know there's just no way we can fully elevate those areas or get rid of all of the concerns that they have, I'm going to be honest with you and fully, realistic with your expectations. So,
We
uh,
appreciate that because
yeah,
we don't
yeah,
want to be sold on something that's not going to help us, men and women. And also, you don't want them to have an unrealistic expectation, right? Is that a big conversation you have with your patients?
every time, every time.
Mhm.
I really am completely honest with them and letting patients know. And if they're going to be a great candidate, I'll tell you that. You're going to be a
Mm,
great candidate. Patients who have,
right.
you know, good bone structure and not a lot of extra tissue in their neck, not excess fat, lots of things that we can do some liposuction, but we're not going to be able to make it perfectly 90-degree angle underneath your chin, possibly. And I'll tell you that, and,
Right.
and I think more nowadays, especially, patients understand the limitations and
Yes.
risks and the benefits and all of that. And they're more open to saying, look, if I can get a better result, it's not going to be perfect. And it's not everybody that I'm going to tell this,
Right.
but those certain patients that I know we won't be able to completely give them the perfectly chiseled look because of their anatomy. I'm going to tell you that. I'm not going to tell you your home run, you're going to get a great result, because in the end,
Right.
if I overpromise and can't deliver those results, then that's on me, right? And
Right.
so, and so you can always expect, if you're going to have a consultation with me, to have me be completely honest with you. And hopefully you'll walk out, just understanding the limitations that you may be up against potentially, you know?
And a lot of women don't want to hear that. They want to hear that you're going to make them look like Christy Brinkley, right? And that's where you really need, as you mentioned, you really need to sit down with them and be really honest about what their expectations are. And I think that happens with every single woman. So if you are if you're not as healthy or if you maybe a little bit overweight, would you ever tell anybody to, hey, listen, I need you to like lose 40 pounds and then come back?
I've done that before. It's
Mhm.
important because if you're going to get your best result, I want you to be prepared to do everything you can do on your end to get you that best result. Because I'm going to give you 100% every time. But your anatomy
Your
is
anatomy is your anatomy,
your
right?
anatomy, right? And so I can
Right.
only do so much.
Right.
And I know that, right? I've got years of experience that tell me that. And
Right.
so if you have a little extra weight in the neck or the
Yeah.
face that I know I can somewhat remove, we can do liposuction. We can get rid of some of it, but we
Sure.
can get rid of all of it. So I do tell patients, especially if you're looking for a facelift or a neck lift and you can lose weight or you're planning to lose weight, you'll get a better result if you lose the weight first. Because you're number one, if you do lose weight after the facelift, you're going to start sagging again because that that little layer of fat is actually making you look a little more plump.
Right.
And then if you don't lose the weight, it's going to be harder for me to pull tight, right? And when I
Right.
say pull tight, we're not pulling tight on skin. It's the muscle layers under the
Right.
skin that
It's
we're.
not the Joan Rivers look.
It's not, and those are the older
Right.
facelift techniques where some surgeons used to just pull the skin and then
Mm.
and not manage any of the muscle layer underneath. And that's where you start looking windswept and pulled too tight and looking unnatural. The corners of the mouth get really tight or the eyes get really tight. And
Right.
so, but again, if I'm trying to work with extra volume that could be, removed by weight loss first, then it's going to be harder for me to get you that perfect result. And so I do tell patients, if you're planning to lose weight, do that first.
Mm-hmm.
Then come back and see me when you're ready, and then we can give you a really nice result. Um, you
What
know, and
is what is the average age you would suggest? And I know you're going to tell me everybody is different, and I understand that, but the average age that a woman normally starts seeing hollowness, her face dropping, like gravity taking control here.
most patients that I see, I can give you an age range
Mm-hmm.
between 41 to 43, 44, somewhere in that range, maybe 40 to 44.
Wow.
And most patients say, you know what, 3, 4 years ago, I was happy. I looked great. In the last 2 or 3 years, I don't know what's happened. I've started seeing changes. It's very common that age range is somewhere between 40 to 44, something like that.
Wow. I thought I
And
was a
it's
kid
minor,
back then.
but it's minor things. We're not talking like significant changes, but it's just little things like this is when you start doing in the mirror, you start going,
Uh-huh.
what's
Yep.
this? What's
Mm-hmm.
going on here? What's going on there? It's
Yep.
minor. You
Right.
start seeing changes, or you start looking at photos of yourself and you're like,
Mm,
where'd that come from? It's
right.
not huge, major things, right? We're not
Mhm.
like talking like 70 years old and things are just sagging everywhere.
Right.
It's just a little thing. And that's where patients start to come in and say, what can I do to get a jump on this? Or what should I do?
Right.
Because I don't really like what I see. It's not super major, but what can we do? And that's typical. It's pretty common, especially for women in that age group.
So if you saw somebody coming in their 50s, you'd be like, where the hell have you been? Why didn't you come to me
No,
sooner?
no, not necessarily. I mean, people start seeing things and things bother
Right.
you at different points in your life too. I mean,
Right.
you could be totally happy until
Right.
50, 60, or you could be totally happy the rest of your life. That doesn't matter to me. But
Right.
the most common age range is that early 40.
Very interesting. I know that there are women listening and are going to take a look at themselves in the mirror. And, this is all about being the person you want to be, being that fearlessly authentic person, standing in your truth, saying, this is where I feel better. And it's not so much, and this is like why I think we need to normalize plastic surgery, and people are talking about it more. I get it. It's not for everyone. But if this is what's going to make you feel better and you're not obsessed, right? You are doing it in moderation. You're doing it in a safe way. You're not every year getting something done. Then go for it, because we only have this one life. And if feeling good means that you look at yourself in the mirror and love what you look like, then do it, right?
Absolutely. I look, and this is what I've said in the past. If there is something that you see in the mirror, and again, it's not going to be something that is affecting your daily life, right?
Right.
Those are other issues, and I do have
Right.
to keep those kinds of things out. When I talk to you, I make sure that you're doing this for the right reasons, right?
Right. Mm-hmm.
But if there's something that you see that I can help you with, and it's reasonable, and your expectations are reasonable, and it can help you be a better you, right? Get through
Right.
your day and never have to think about those little things when you're presenting yourself in a
To the
meeting
world.
to the world,
Yeah.
right?
Yeah.
And I can help you achieve that and make you feel and look on the outside the way you feel on the inside,
Yeah.
then I think why not, right?
Right.
There's a stigma around plastic surgery. There
Right.
is, right?
Right.
I'm hoping that we're turning that corner
Mhm.
because I feel like a lot of the stigma was you look crazy and unnatural. I
Right.
don't want to look like that. And like, how could you do that?
Absolutely. Right.
But for facial plastic surgeons like myself, who are more about being conservative and
Mhm.
helping you achieve your goals and just look and feel better about yourself,
Yeah.
I think to me, I'm more than happy to help you to achieve that. And there's nothing wrong with that.
I know.
I would never do anything that's going to make you look unnatural in the first place.
Right. Your before and afters are beautiful.
Oh, well, thank
They
you.
really, really are. Let's talk about your signature champagne brows. Tell me what that involves, and is it because of Chrissy Teigen and Meagan Good that brought your name to the forefront with the eyebrows? I don't know anything about this type of transformation.
Yeah, well, let's get into it.
Yeah,
There's a lot to talk about when it comes to that.
I might have to come out to Beverly Hills and get mine done because I used
We,
to have thick eyebrows.
we'd love to have you.
Okay.
So I would say it's been about 8 years ago, 8, 9 years ago now. I realized that there was a trend of getting back to the fuller, more natural eyebrow look from that over tweezed kind of pencil thin look that was in the 90s and early 2000s. And I started having, because I'm a hair restoration surgeon, I see a lot of patients for hair restoration, and I started having patients asking if there's something that could be done. Eyebrow transplantation is not, I didn't invent it. It's not something I invented, but I took the technique that I had done one or two of in my training. Eyebrow transplants weren't very common back in
No.
the day. And I took that and I sort of honed the technique and made it mine to where I can really make it look very natural, as if it's your eyebrows that have always been there. Because I've seen some horrible results, and there are techniques that hair restoration surgeons who do hair transplants on the scalp just take that process and just put it into the brows, but it's not the same. And so that can look very unnatural if you're not really paying attention to the angle of exit of hair and the natural flow of eyebrows. And this is where the artistry comes in.
Mhm.
So, like I was saying earlier, and you were talking about, having that eye is very important, especially when you're creating something that has to look exactly like an eyebrow.
Right.
Mother Nature is amazing,
Yeah.
genetics are amazing at creating that eyebrow shape. And if you can't recreate that with your hand, then it's not going to look natural.
Mm.
So what I do is we borrow hair from the back of the head, typically, or above the ears. It's the best hair, donor hair, to create eyebrows. Um,
Why is that?
the texture and the density matches best, or diameter, I should say. So your hair diameter and the texture of it matches best
Okay.
than using other types of body hair, for example.
Mhm.
And so that it's usually the best hair. Now, not everyone's a great candidate for an eyebrow transplant because of the hair texture on their head may not match hair texture in their eyebrows. So really, really curly hair, very tight curl hair, or very coarse, super straight like nails hair
Mhm.
doesn't really work that great for eyebrows. So the ideal candidate is going to be someone who has hair that is somewhat bendable, not super coarse,
Mhm.
and also the diameter matches pretty closely to the eyebrows. the good news is that the majority of patients fit into into that category, right?
Yeah.
And so that's good for us because we can really give you a nice result. So I take hair from the back or the above the ears, and then under microscopes, which you see behind me actually,
I
because
see them.
hair restoration room, we divide those hairs into individual hair follicles, one follicle, one hair at a time, very carefully under microscopic visualization, so we can see the entirety of the hair system from the skin surface to the bottom of the root. I personally will draw in the plan for your brows with the shape, the arch, the peak, the tails, everything that needs to be done to balance your face. Eyebrows, to me, are one of, and I think most people understand this, they're one of the most important structures of your face.
Yes. And
They,
when people have very light hair, or I know every once in a while there's this trend where you have no eyebrow or you shave the eyebrow, you know, it just changes the whole look of your face. Exactly.
even bleaching them, you know, like
Yeah.
sometimes
Yeah.
models will bleach their brows temporarily, and
Yes.
it just changes your face.
Yes.
They've done studies where you take away the eyebrows of a celebrity, and it's harder to tell. It's harder for people to tell who that person is without eyebrows than it is without the eyes.
Wow.
Leave the brows in place and take away the eyes, those celebrities are more recognizable than if you took the brows away and just left the eyes.
Crazy.
So they're extremely important, and
Yes.
they set up the structure and balance of your face. So a very aesthetically pleasing eyebrow is going to frame your nose. It's going to frame the corner of your eye, and it's going to accentuate your eye. It's not too thin. It doesn't show too much brow bone. So fuller, natural looking brows are a more youthful look. We associate that with youthfulness.
Yeah.
And that's my goal when I'm doing the champagne brows procedure, is to give you back that fuller, more youthful look. So
Is a straighter, I always feel also that a straighter eyebrow, sort of like yours and mine, well, you're a man, but I remember getting Botox and then lifting my eyebrows really high, and I said, do not do that. That ages me like 10 years. Please put them back down to where they're supposed to be.
yeah, no, the high arch is not a natural look. Having that really arched
No,
McDonald's M kind of look is not a
I
natural
don't like it.
look.
No.
It ages you for sure, because it kind of opens up your eye too much and it makes you look surprised, and it doesn't look natural, right? A soft arch, the way I describe it, is sort of like a bird in flight, where you're slightly elevated wings, right?
Yeah.
That's sort of a natural softening of the face. It frames your eyes. It makes you look, again, more youthful and
Yeah.
natural than the harsh, sharp points or angles
Right.
of the eyebrows. And so something that softly balances with your face and doesn't create angularity, I think overall looks more natural and youthful. And so that's
So
sort of what we go off of.
yeah. So do you so you fill in where you feel that it, how do you know how much to fill in? I mean, that's where your eye comes in, right? And does anybody ever ask to change slightly the shape of their eye? And do you do that while you're doing that as well?
Yeah,
The
occasionally.
eyebrow, not the eye, the eyebrow.
Yeah, occasionally I do. I mean, it's personal preference, obviously, too. So I'm not going
Right.
to sit here and dictate exactly what your brows should look like. I'll
Right.
give you my expert opinion. I will mark in the areas that will balance with your facial features. And not everybody's eyebrows is going to be exactly the same. Just like we talked about earlier, nothing is
Right.
exactly the same on everyone. So
Right.
I'm using the measurements of your face and where the, aesthetically appealing eyebrow should sit on your face, because your eyes might be a little farther apart than some. The nose might be a little bit broader or more narrow than some. And that's going to set where your brows should start and end. And so I'll look at your anatomy. We'll take measurements of your face, looking different facial shapes can accept certain brow shapes. So more square faces, you don't want straight kind of flat eyebrows, because that's going to make you look too square.
Right.
Round faces, you don't want round eyebrows. It's going to make you look too round. So I look at all of these things and give you my advice. And of course, if you have a certain preference, it's your face, and I'm happy to help you with that too.
Right.
But overall, I want to give you something that you're going to be happy with. And most patients defer to me, to be honest. They'll say,
Right.
"You're the expert. I
Of
trust you."
course.
I'll draw them in and they'll be completely happy with that. But there have been a few patients that said, I'd like this a little thinner here, or I'd like a little more of an arch underneath, and that's totally fine, absolutely.
Right.
But I draw the brows in.
Mhm.
I personally will each little hair has to have a little incision in the skin to accept the root of the hair, right? The
Wow.
follicle.
Mhm.
And so I will draw the brows in first, morning of the procedure. I give medication to relax you after that. Once we've agreed on the shape, shape doesn't change again after that.
Mhm.
I use local anesthetic to numb the brows and to numb the area where I'm borrowing the hair. I will get to work making all the little incisions in the skin, and it's hundreds of incisions for most patients.
Wow.
For example, if we're starting with bare skin and just some microblading or just no hair at all, it can be 350 to 400 hairs per brow.
And you're awake during this?
Most patients are sleeping because I give oral sedative to help you relax.
Okay.
So most patients drift off to sleep, especially
Mhm.
once you're numb. You don't feel anything at all. Most patients are sleeping in the chair for most of the day. It's a tedious process. It takes several hours. The average brow is 5 to 6 hours, both to do two eyebrows,
Wow.
because each hair is placed one by one, very carefully, very specifically in the proper angle and flow so that they create a natural looking brow.
Mm.
So when I make those incisions in the skin, I'm as shallow as I can be right under the skin so that the hairs lay as flat as possible, because eyebrow hairs lay very close to the skin.
Right.
And then I'm also making sure that the direction is proper too. So in the front, they're going to grow up, and then they're going to start to transition over and create that natural eyebrow flow. And then one by one, we come back and put the hairs into those openings that I created, and then make sure everything looks perfect before we're done. So 5 to 6 hours later, you walk out with your brand new eyebrows. The hairs are there. You see them,
I want this.
and you have the shape, and that's how they're going to grow. Okay. So hair on your head, though, grows permanent, long. So
Right.
when we place hair from the head, it's going to continue to grow like it's on your head. It doesn't know it's
That's
supposed
on
to
your
short eyebrows. So
right.
you do have to trim them, but the trimming is very minor. And I've never had any patients concerned with trimming now that they have their new eyebrows, right? So
Right.
you're not having to pencil them in. You don't have tattoo on your skin. You actually have real hair. It's your hair. It's going to grow there for the rest of your life. It doesn't fall out ever.
Wow.
And so you just trim once or twice a week, a little gel or wax to have everything flow together, and it's a natural eyebrow. It gives you that three-dimensional look that
Right.
is lacking when it comes to microblading, powder brows, tattooing, all of those procedures that try to make you look like you have an eyebrow, but it's not real hair.
Let me tell you, I had microblading done
You
about
did.
4 years ago. Thank goodness it was COVID. Like I had it done in February and then the whole world closed down. I look like Groucho Marx. Now, most of the people I know don't even know who Groucho Marx is. And but that's who I look like. It was not pretty at all. And I couldn't wait for it to fade away. There's still a little bit left, but I couldn't wait for it to go away.
You're a lucky one, I'll tell you, because it did fade mostly. I've seen many patients where they did it 4 to 6 years ago, and it's still just as dark as it was before.
Oh,
It has to do with some of, the technique, your skin. If you have oily skin, it tends to fade quicker and are easier than if you have very dry skin. But I've seen some patients that it just doesn't ever fully go away. And then there's some other challenges with that where we're trying
right.
to cover it over with eyebrow transplant hair, or
Right.
you might want to remove it with laser pigment removal system, a dermatologist, have someone do that for you first. So there's a lot of things that are involved in that, but it's still doable. And that's something I'd like to touch on if we have time, because
Yes, we
I
do.
have so many patients who microbladed
Hmm.
first because
Hmm.
they didn't realize that eyebrow hair transplantation is an option and that it's a permanent thing. And so a lot of patients I'm consulting with, I had a couple of them this morning actually, before this, and both of them had done microblading first, a couple times. And so the more times you do it, there's potential for some scar tissue in your brows.
Right.
Hair transplantation works best in normal skin without microblading pigment or potential scar tissue from those processes.
Right.
And so hopefully, just like with this, we're talking about it, more patients are aware that there's another option.
We're
Because,
educating people right now.
yeah, in my opinion, microblading, and the microblading specialists are going to hate me for this, but
It's okay.
microblading never fully looks natural. And the more times you have to do it, the more risk you get for it to bleed into itself or look blocky or turn colors even. I've seen different pigment colors. There are really, really good microblading specialists, and there are not so good microblading specialists. But over time, and maybe I'm seeing the patients that are just completely unhappy with their results, but I see a lot of them. Over time, it just doesn't ever look fully natural.
I agree.
And so patients are seeking out a better option, and that's where they find me, and we can do a hair transplantation on top of the microblading. But I will tell all of your listeners, if you're considering doing microblading, just know that there's a hair transplantation option, because I have so many patients that are unhappy with their microblading results in the long run, especially.
I'm want to get this done now. Why do we lose hair? This is something I've never figured out. Why do we lose hair in our eyebrows as we get older? Is it the same reason why our hair gets thinner as we get older? The same thing?
Yeah,
Lack of hormones,
yeah, I
age?
mean, it has lots of things play a role
Mhm.
in hair loss as we age. Men especially too, you start to see loss from the outside in and from the inside out.
Right.
End up with these, smaller middle brow here. But women do too. A lot of it has to do with just the aging process in general. Some of those follicles just burn out over time. Eyebrow hairs are weaker hairs in general than hair on the head too. The hairs are kind of finer and smaller, especially on the ends. You have those little tiny wispy brow hairs.
Right.
And so those are easier to kind of go with time. Hormone changes, thyroid issues can cause hair loss. And of course, those are all things I'm evaluating during our consultation too, is making sure that you don't have hair loss for another reason. But the biggest cause of hair loss in the brow, especially in women, is going to be over tweezing or waxing
Oh,
or,
really?
or threading. Yeah. Because it's like I think I was saying earlier, the 90s brow, the early 2000s was that tweezed look. So
Mm-hmm.
a lot of women were in the mirror every day or every other day, tweezing out those little hairs.
That was my daughter, who's now 35. She did that, 15 years old, comes downstairs, and I said, "What the hell did you do? Like
Yeah,
those, I don't know if those eyebrows are gonna ever grow back."
right. And so if you do it once or twice, hopefully you're lucky and they do grow back, and they should.
Right.
But the more you do it, the more tweezing, the more trauma each follicle is experiencing. So every time you pull at that root system,
Mm.
if you traumatize it enough, you create some scar tissue and traumatize the surrounding tissue to where the blood supply just doesn't grow back, and it eventually can kill off the root system. So that's why a lot of women from over tweezing through the years don't get all of that growth back. The good news is we can transplant them back in place, but again, if you can never tweeze your brows and keep what you have, that's the better route. Because
Don't tweeze your brows.
yeah,
Don't get microblading done.
yeah,
And you know what's funny is that I was never a big tweezer person, and my skin is very reactive, so getting waxed was not an option. I got burned underneath my eyebrow like back in 2002, and I never had my eyebrows waxed again. But I just noticed over time as I got older that my eyebrows got thinner, and it just wasn't a good look for me. So
yeah,
I'm being completely honest with you. I need to come out to see you, because I want this. And it does. The eyebrows, when I look at my daughters and they have these beautiful thick eyebrows, it is like hair is a sign of youth, the full lips, not full, like crazy full, but everything. It's why people get breast implants, why people get facelifts, hair implants, hair restoration. I wanted to also ask you about something that I've been reading a lot about too, that you do is jaw surgery, chin implants, forehead reduction. So I don't know where I saw this recently. It must have known that I was going to have you on my show. It was before and what people would look like with a chin and what they would look like a celebrity. For example, they took Angelina Jolie. Did you
I
see that
saw that.
too?
I did, yes.
What would Angelina Jolie look like without that chin? Can you explain to everyone listening how important that balance of the chin is to the whole face structure, like the eyebrows, you know?
Yeah, no, absolutely. So there's a golden ratio. You may
Mm.
have heard about that. And I've seen this, before too, where, and they do this a lot of times with
Like the
celebrities.
nose
Say,
and
what would this celebrity look like with the perfect golden ratio of the face? Meaning the eyebrows in the right position, the eyes in the right position, the nose, the chin, the lips, in these perfect proportions. No one's perfectly symmetric. Some people are really close, and those are the
like
ones.
who? Like, give me the name of a celebrity that you know that looks pretty, so we know what you're talking about.
I mean, so it's hard to say
Sorry.
exactly who is. It's the more beautiful faces. So like an Angelina Jolie, for example,
Right,
the
right.
ones that have the chiseled jaw lines and the chin seems to be perfectly matched to their nose, and their
Yes.
eyes aren't off, and their nose is like pretty much right down the middle of their face. Those kinds of faces, it's the ones that you kind of think of at the top of the list,
Totally.
the most beautiful faces in the world.
Mm-hmm.
The Brad Pitts, all of those
Right,
celebrities. But I would say, like, for example, you were talking about Angelina Jolie without a chin and with the chin. The
right.
biggest thing is going to be symmetry and balance. Our brains are programmed to see symmetry as a beautiful thing, as a
Mm.
good thing. It goes way back to, it's sort of like, it's part of evolution, I think,
Right.
right?
Mhm.
Insects, birds, the more beautiful your feathers, the prettier your show of, we've all seen this. The female will choose according to that, right?
Right.
I think our brains are also programmed to see symmetry and certain features as being more beautiful and more desirable.
Yeah.
And we just see that. We know it, right? We just know it when we see it. We don't do it intentionally.
No, I mean, I competed in fitness shows for 10 years. Became a two-time world champion at 49. And it was all about, it was bikini, but it was fitness. So it was all about symmetry, beauty and symmetry. So just what
Yeah.
you're saying, and people, um, the person with the most symmetry usually won.
Yeah, I mean, and I think I mean, of course, those are things we can judge on. And then I'm not saying we should be judging anyone for their
Agree,
beauty or
agree.
symmetry. Whatever makes you happy,
Right.
that's what we're really going for, right?
Yes.
But if we're talking about symmetry and beauty and what the ideal look would be, I can get you closer to that if you are lacking a chin.
Mm,
If it's a weaker structure, there's
mm,
something we can do about that. There's two options. Or several options, but the two main options are a little filler
mm.
injectable into the chin to give you
Oh,
that projection. It's temporary. A lot
right.
of patients might choose that initially just to kind of see what it would look like to have a more permanent result.
Sure.
And that's an easy in-office procedure, but that dissolves over months to a year or so.
Mhm.
And then the permanent option is an implant, where the ones that I use are a malleable type silicone. It's not like a breast implant. It's not a liquid substance. It's a firm substance, and it's in the shape of a chin, but it's placed under all of the tissues right onto the bone of the mandible. This is your
Mhm.
mandible. I make a little incision underneath the chin, hidden it way up under here that no one would ever see. Place the implant right at the bottom of the mandible, and it helps to, if you need the width, we can
Mhm.
adjust the width of your chin if it's very, very narrow, especially in men. To have a
Right.
wider chin is a little more
Right.
desirable for some guys. For women, a little more, a narrower chin, just in keeping with the feminine structure
Right.
of your facial shape. But projection can be changed as well. So we can change the projection of your chin. What I look for is symmetry. So I'm looking at the front of your face. I'm looking at the oblique view of your face where you're sort of a quarter turn.
Mm.
That will show how the jaw and the mandible, the jaw line,
Right.
or, a layman's term, matches with the chin. And then also the profile view and how that balances with your face from a side view. Because 9 times out of 10, patients are okay with their chin from the front because it's hard to tell.
Right.
But most patients will come in and say, in photos, or when I look at myself from the side, I don't like how my chin looks here. Or
Mm.
it looks like my neck and my chin are all one. I don't have any distinction between the two. And that's the most common. It's become very popular, for good or for bad, with
Yeah.
with COVID and with the pandemic.
Right.
We were doing a lot of this. We were doing a lot of online,
Right.
keeping in touch with each other online, or social media, or just FaceTime or whatever. And more people were seeing themselves sort of from this position, or they were looking to the side and like, oh my gosh, what's going on here? So the good news is there's something we can do about it. If it bothers you, we can
Right.
definitely improve on the symmetry. What I specialize in is a custom made implant, where we take a 3D CT scan of your bone structure, and it's made specifically for you to fit your bone structure. So once we have a 3D CT scan of your skull, I work with a medical artist who helps me design the implant. So I know, looking at your tissues and your bone structure, in my mind, I will create an implant that will improve the width or the projection or the height, whatever you would need to help balance your face better, give you the improved symmetry. I can create that implant to those specific parameters. And then once it's in place, the backside of that implant fits perfectly to your bone structure. So again, no one's the same. Our mandible, our bone, has little irregularities, little bumps and indentations and all these different things. A lot of us, you can feel little bumps and things if you press hard enough, and you may have some asymmetries of the bone. So like one side of your jaw, might be a little higher than the other, and that's completely normal. But again, those golden ratios and those
Yeah.
more symmetric, aesthetically pleasing faces have better symmetry. So the heights of the jaw, it will be a lot closer, and the chin will be perfectly projected to balance with the nose. There are certain lines, that tip of the nose to the bottom of the lip to the chin. If everything is in line, it's more aesthetically pleasing versus
Oh my
having.
goodness. I'm like looking at my face as you're saying all these things. I'm thinking, what do I need? What do I need?
And it's not about that. It's not about
Right.
what do I need. That's not why we're talking about this today, but it's just more about awareness, obviously. But
Yes. Yes.
those are the things that I'm evaluating when my patients come in and say, I can't put my finger on it, or, what's going on here, and what do you see? So I'm evaluating those parameters to see where and it may not just be your chin. Your chin may be,
Right.
your nose may be over projected. So it's
Mm.
looking like your chin is weak, but it's really your nose is over projected. So it may be we address your nose and not your chin. So all of these things are important. That's why a consultation with me would be the most important thing you can do, because some people come in saying, I need this, and it's actually not that. It's something else that they might benefit from. But
Right. Because you're looking at them with a different set of eyeballs.
yes.
And you know what can be tweaked, what might be quote unquote missing, what it is that they're looking for, right? Because as you said, everybody's looking for that symmetry. They may not say those words, but that's what they want.
Right. When they look at themselves, they can tell something is off or doesn't
Not
match,
right. Yeah.
not quite right, and that's what's bothering them. And then we can do something about that. Some people, they just have too much fullness or skin in their neck. Their chin
Mhm.
might be okay. It might be a good projection, but they just have too much here. So
Mhm.
some people say my chin, they're talking about this, which is not the chin, but that's what a lot of people say is their chin as well. I've got this chin waddle, or I've got this fullness in my chin. So I also keep that in mind too. And sometimes it's more of maybe liposuction or skin tightening or some combination of both. A neck lift, a minimally
Right.
invasive neck lift, which is a suture technique to just tighten the muscle. Lots of options that we have. But I make sure that I'm giving you a recommendation that's going to best benefit you, because it may be your chin, but it may not be. It may be something else that's causing you to see what you're seeing.
You
And so,
sound so compassionate. And I think that bedside, from the way I'm hearing you, like your bedside manner must be amazing. I could just tell that you have a good heart and that you're looking for the right thing for each patient. And I think sometimes, if correct me if I'm wrong, you have to be somewhat of a detective, right? They come in saying it might be my neck, and you really have to get to know the patient to figure out and navigate around what it is that's bothering them or what
You,
they're looking for.
I do, and really, the way I approach it is I just have your best interests at heart. Like that's what
Mhm.
matters most to me, is doing the right thing for you.
Yes.
Because if I do the wrong thing for you and don't help you achieve what you were looking to achieve because you came in and said, I want my chin done, I'm saying, oh sure, I'll do your chin. And
Right.
that doesn't fix the issue, or doesn't help to correct the issue that you actually came in for, then again, that's on me. That's my fault. And I want to develop a relationship with my patients where they can trust me and where they can really truly believe that what I'm offering them is achievable and
Yes.
reasonable, and that they can come out of it not having to worry about the risks of the complications. And of course, any surgery has a complication
Of
risk,
course.
but we can avoid some of those risks by doing the right thing and choosing the right procedure for that patient.
Mhm.
Uh, and so that's, to me, that's the most important thing. If I can have patients understand anything about me and my
Right.
practice, that's the most important thing that I want to have come out of my practice, and patients who see me for that reason. I would never do things for patients. And I've had some patients ask me to do these really unnatural looking jaw angles and really wide that doesn't fit their face, and they're gonna walk around looking unnatural. I wouldn't do that. I would never
Mm.
agree to do that just for the sake of doing it. I could do it, but
Sure.
I
But
would
you're
never
not going
want
to.
to do that. That's just how I
Right. It's like, I'm not your guy. If that's what you want, yeah, I don't want you walking around the world saying that this is what I did for you, because
yeah,
that's not what I
that's
think you
just not.
need.
Yeah, oh, and it's that's not me. That's not what I'm out to prove. I'm not out to prove that I can do whatever. I'm out to
Right.
achieve natural looking results for patients. And if that's what you're looking for, that's me. If that's not what you're looking for, then there are other surgeons out there that can help you. But
Right. Of course.
that's the
So
practice
let's
that I want to build, and I have built.
let's talk quickly about, because we are running out of time, unfortunately. We've got about 5 minutes left. Can
Wow,
you touch, I know, can you touch on the Champagne Hairline Refine?
absolutely. That's a unique procedure that not a lot of surgeons perform. It's a hairline revision, basically. So the best patient for this is usually a female patient who doesn't have a history of hair loss. Most guys who have a high hairline, it's because of hair loss at the hairline.
Right.
Women who have a large forehead or a high hairline, typically it's just genetic. They were born with it. A lot of my patients are younger patients because they were teased as a child or in their teens for having a large forehead. They were
Yeah.
embarrassed by it. They cut bangs to cover their forehead. And we're just talking asymmetry. That's what it is.
Right. Right.
It's a disproportionate forehead compared to the rest of your face.
Right.
And so if you have a high hairline, meaning this part of your forehead or this part of your face doesn't match the middle and lower third of your face, I break it into thirds,
Okay.
you're going to see that asymmetry, right? And so,
Interesting.
right. And so when you look in the mirror, these patients see forehead first and
Right.
then the rest of their face.
Right.
So a lot of times they'll come in, they say, I never pull my hair back. I cut bangs to cover it.
Mm.
I don't like to go swimming. All of these things that
Right.
obviously affect their day-to-day life, right?
Yes.
They are not their full authentic self
Hmm.
because they're trying to hide this part about them that they're embarrassed about. And if I can
Right.
do something about that, why not? Right?
Hmm.
And so this procedure has a very high patient satisfaction rate, first of all, because these patients have thought about this for a long time. It's a little incision right at the hairline.
Hmm.
Okay. So I follow the natural undulation or natural flow of the hair at the hairline. I make a little angled or beveled incision across the first few rows of hair. And then I actually will move the entire hairline and scalp forward and remove we're getting a little more involved here, but to describe it is necessary, I think.
Yeah.
because it's not a hair transplant procedure.
Right, right.
And I remove that portion of the forehead of skin that doesn't have hair on it so that I can advance the hairline forward. And then I suture that across the hairline. And now your forehead is shortened. Your hairline
So
is.
cool.
And so when I measure the thirds, I am trying to get you to balance better, right? So that hairline will come very close to the average of the thirds of your face. And then that leaves you with better symmetry. So, and I've treated lots of patients. I have some A-listers that won't talk about it, which I understand,
Sure. Mhm.
that have done this procedure. And it's really, in my hands, it's imperceptible that it was done. It should be. I know I'm saying I'm making an incision at the hairline, but the goal of the procedure is to have that be camouflaged when it's done properly, so that you never even notice that there's an incision line there. It's not a wide, ugly, visible scar or anything like that.
Life-changing.
It's life-changing, and it's
Mhm.
instant. It's instantaneous. The surgery, when you wake up, the first day you have a little bandage. The next day, when we take that off, you see your new hairline. It's there and it's done. Different than a hair transplantation, which takes time to grow. And I can't get the density of the hair in a transplantation that I can with the hairline lowering procedure. So the Champagne Hairline Refine is that specifically. It refines the hairline and gives you that new hairline instantaneously with the density of your natural hair. That's why it works best for women too, so that we move all of that nice dense hair that you have just a little lower onto your forehead to balance you better.
Amazing. I've learned so much from you. I really mean it. Like, as soon as we get off the phone, I'm going to reach out to you off this call because I want those eyebrows. I want those eyebrows.
Please, maybe we
How
could do a
can,
collab, you know?
okay, how would our listeners get in touch with you? What's the best way?
So either phone or email would be easiest to get in touch with my patient coordinators. So phone number is 310-859-2379. The
Okay,
email is info at jasonchampagnemd.com.
easy.
Easy. My Instagram is at Dr. Jason Champagne, Dr. Jason Champagne.
Mhm.
And you can also contact us through Instagram. There's a little button on there where you can email us or reach out to us that way. So
Okay, wonderful. Dr. Champagne, it has been such a pleasure to have you on the show, educating us, empowering us so we can live the life that we want. I really appreciate it.
absolutely, it's my pleasure and it's been fun.
Yeah, good. I'm glad.
Yeah.
Thank you, everyone, for joining us today. I hope you learned so much. I would love to hear from you. So please keep asking me those questions. And until next week, go live your most fearlessly authentic week. Bye bye.